Hello, Dr. Ben Gelfand here, and today we're going to discuss a special test for anterior impingement of the hip, otherwise known as femoral acetabular impingement, that can result in a labral tear. But the real problem is not the labrum, it is the pinching of the femoral neck against the rim of the acetabulum. So in order to do this, we have the patient lying supine. We bring the leg or the hip into flexion. And remember, this is a provocative test, so we have to go to the end ranges. Unfortunately, because it's a provocative test, it will cause the symptoms that the patient is feeling and will be uncomfortable. It's going to be up to us to realize we don't have to jam things to the end range, but we have to bring it to the end range to provoke symptoms. So we're going to go into flexion first, then adduction and internal rotation, just like that. And in doing so, you could see how we're bringing the femoral neck all the way inward to press on the acetabulum, the anterior medial aspect of the acetabulum. So once again, we go from full extension, bringing it up past 90 degrees till we feel an end feel, right? An end point, going into adduction and internal rotation, and you'll feel yourself sort of gliding along the rim. Then we come here to the maximal internal adduction and flexion, and the patient will normally feel some pain. If there is no pain, but we feel that maximal endpoint with those three movements, then most likely the patient does not have a labral tear and or impingement of the hip. Thank you, and be well.